Lindsey. I understand you had come in before you were experiencing some symptoms of fatigue, losing weight, and diarrhea.
Yeah, I had some abdominal pain too.
Okay. So you were sent for some tests for that, I believe, right? Do you remember that?
Yes, I went for a barium follow-through and a colonoscopy.
Okay, so we've actually got your results back from that.
Okay.
So it looks like you do have a diagnosis of Crohn's disease.
Okay.
Do you know what that is?
No, I don't.
No? Okay, well let me show you.
The body's digestive system is composed of several structures and has 6 functions: ingestion, mechanical and chemical digestion, absorption, propulsion, and elimination. Crohn's disease is a chronic inflammatory disease of the digestive tract. It is thought to be autoimmune and is linked to genetics. Crohn's can affect the epithelial tissue throughout the entire digestive tract, but most commonly affecting the small intestine.
In the small intestine, circular folds force chyme through the lumen, slowing its movements and allowing time for full absorption. In the villi are epithelial cells, which are simple columnar absorptive cells that absorb digestive foodstuffs and move them into the capillary blood vessels and lymphatic system. In Crohn's disease, the body tends to recognize harmless bacteria as harmful invaders due to antigen hypersensitivity. In response, the immune system attacks the cells, causing inflammation. During inflammation, inflammatory chemicals are released, such as histamines, bradykins, and prostaglandins. This increases capillary permeability and blood flow to the area. This process attracts leukocytes such as neutrophils, monocytes, and lymphocytes, and with the increased permeability, they are able to move to the membrane and enter the affected tissue, and then phagocytosis is induced. In Crohn's disease, due to genetic factors, the inflammatory response does not stop. Chronic inflammation causes ulcers to form on the bowel, causing pain. It also causes swelling and scarring of the intestine. Inflammation and scarring can lead to narrowing of the intestinal wall. The narrowing of the wall can cause intestinal obstruction, which explains symptoms of abdominal cramping, bloating, and nausea. Abdominal cramps can lead to limited food intake, and so nutritional requirements are not met, causing weight loss, malnutrition, and secondary anemia. Since the epithelial cells are affected, molecules such as electrolytes, water, and nutrients can't effectively cross the cell membrane, causing disruption of absorption. This means that food is quickly being passed along through the GI tract, causing chronic diarrhea and nutritional deficits, resulting in weight loss from inadequate food intake and constant fluid loss.
To summarize, Crohn's is an autoimmune disease that affects the digestive system and specifically the small intestine. In Crohn's, the homeostasis of a normally functioning gastrointestinal tract is disrupted by the excessive inflammation and narrowing of the small intestine. Embedded in the cell membranes in the small intestine, there are multi-protein complexes known as tight junctions that help attach cells to each other to form the protective epithelial barrier. The greater the number of rows of proteins in the tight junction, the stronger the cell-to-cell attachment is. In Crohn's disease, there are a reduced number of proteins, which leads to an increase of permeability of the epithelial barrier. This allows more bacteria to pass through the epithelial barrier into the submucosal layer of the small intestine. So, Lindsey, after having watched that, does Crohn's disease make a little bit more sense to you?
Yes, it does. Thank you.
Okay. And in regards to treatment, your doctor will probably prescribe you some immunosuppressants, so that helps stop the immune response that leads to inflammation, and as well corticosteroids, and that's to reduce the inflammation itself.
Okay.
2 other things that I would suggest you be careful with is to limit your stress, and then keep a healthy diet. Anything that's bothering your stomach, try and avoid those kinds of foods.
Okay.
Do you have any other questions for me?
No, I think that's everything for right now.
Okay, so come on back if you do.
Okay, thank you.
You're welcome.